All right, so we'll start with the C-spine, all the way at the top of the vertebral column. I'm going to go through this pretty quickly because this is, again, mostly review. I'm just going to show you from a cross-sectional perspective, but other than that, in a coronal or a sagittal, it should be pretty self-explanatory because that's an AP and a lateral, which you should all be familiar with. So this study here, the first study, and again, all of these are linked in the course under Research and Helpful Links. I'm going to start all the way at the top here at this is an axial of the C-spine. So here we have the occipital bone of the skull coming down, and it's going to articulate with this superior articulating process right here of the first cervical vertebrae, the C1. So C1, or the atlas, articulates with the occiput of the skull. That's your atlanto-occipital joint right there, the superior articulating process. Here's your anterior arch, transverse foramen. Transverse foramen, remember this is where the nerves and vessels can come down from the skull and enter the neck. Your odontoid process, just posterior to the anterior arch in the vertebral foramen. And then as we go down, here's your posterior arch. And this is not a fracture in this patient. This is a normal cleft or a non-union of the posterior arch of C1. So here's your odontoids. Now we need to follow the odontoid down to start looking at the anatomy of C2. And then here, again, these are your lateral masses of C1. So let's travel down the odontoid. You have the superior articulating process of C2, of the axis. So that's the atlanto-axis joint space that is formed between the two. So again, allowing for rotation of the skull side to side, atlanto-axial joint. The odontoid process coming down, and then here you have your pedicles, pedicle, and posteriorly lamina. All right, transverse process, body, and then here's your bifid spinous process here. It's kind of not quite, but it is. It's definitely more prominent as we go C3 through C6. All right, so that is your axial view. Let's go over to a sagittal. What I want to point out in the sagittal is the anterior arch of C1, the odontoid process protruding superiorly, just posterior to the anterior arch. Your posterior arch is back here, spinous process of C2, which you can see is kind of like that bifid. We're kind of seeing that bifid posterior spinous process, and then the body of C2. And then once we get down into C3 and down, they start to kind of take on a more typical look of the vertebrae. So let's move into the T-spine. T-spine, this patient has a burst fracture of their sixth thoracic vertebrae, T6 burst fracture. So we can use that to help count because it tells us, or we can look for ribs and count. So let's see, where's my first rib coming off? Probably about there. 1, 2, 3, 4, 5. Nope, it's here. Right, there it is. So here's 1. T1, 2, 3, 4, 5. There's 6. Foramen, vertebral foramen. 7, 8, 9, 10, 11, and 12 is just kind of cut off down here. So here's your vertebral foramen, and then here is your vertebral canal, where your spinal cord is going to be housed. Spinous process of the T-spine coming down, bodies of the T-spine, and again, T-spine nearly identical to the lumbar spine, except we're going to start to taper into larger bodies as we go down. And then remember, lumbar spine, as we get down, actually it's down there, the bodies are pretty massive compared to the rest of the vertebrae. Moving on to lumbar, this study has plain x-rays as well as CT. So let's go to the, oh wait, you know what I didn't do? I didn't do axial views of T-spine. So let's go back to the axial. So here's the axial, and we'll go all the way to the top. There's C7, here's T1. T1 right here, here's your rib, your first rib coming in. Remember, we have our joint spaces that we have to account for or know in our thoracic vertebrae, our joint spaces that are formed between our rib and our spine, or our vertebrae. So we have the costo-vertebral joint space, and then down here, our costo-transverse joint space, or your facet, okay? Vertebral foramen, spinous process, transverse process, body, okay? So those are your T-spine. L-spine, again, this guy's got a fracture as well. You can see it in the sagittal, if I click to the sagittal. So looks like he's got a good crushed body of his lumbar vertebrae. Vertebral canal, that's going to allow for the spinal cord. And then as we get down to L1 and down, remember we're going to start getting into the filum terminale and the cauda medullaris and the cauda equina and the intrathecal sac, the subarachnoid space down here. This guy's got some air in his disc space. So when we look at the disc, you can see he's got some issues going on with his disc spaces. The discs themselves, the space or that cushion, those shock absorbers between these massive bodies of the lumbar spine. Inferior articulating process, superior articulating process, zygapophyseal joint space, intervertebral foramen. All right, when we get down into the lumbar spine, you have the cauda equina that's going to start shooting out of these big, huge intervertebral foramen. Let's go back to the axial. Large, massive body, vertebral foramen, spinous process, transverse process. We have pedicle, anterior, lamina, posterior. Okay? So there's your lumbar spine. Let's move on to the ligaments. So we have the anterior longitudinal ligament, which you can see here. It's this dark line that's traversing the anterior portion of the spine, of the spinal canal. So there it is. You can see it actually really good here. See this density coming down, traveling the entire length of the spine. That's your anterior longitudinal ligament. That's that broad, fibrous ligament extending and attaching the anterior of the bodies of the vertebrae. And then posteriorly, you can see it here as well. This darkened area here, that's your posterior longitudinal ligament. Remember, that's going to help prevent the intervertebral disc from bulging posteriorly and pushing on the spinal canal and these nerves that are hanging out in the spinal fluid back here. So posterior longitudinal ligament here, and then you can see pretty well on this guy your ligamentum flava, the flava flav. It's this stuff in here, this darkened area. Okay, it connects lamina to lamina, remember, on both sides. So that's your ligamentum flava in the lateral view. I do want to skip ahead and just show the discs here. So you see the darkened area around the outside, and then this lighter area on the inside. So those are your two different layers of your discs, the intervertebral discs. The innermost layer, this lighter area, that's your nucleus propulsus, and the darkened outermost area, that's your annulus fibrosus. Okay, so the two different areas you can see. On this, the darkened is the outermost, the annulus fibrosus, and the lighter is the innermost nucleus propulsus. Okay, and it's pretty normal on this guy. You can see a nice straight vertebral column here. The discs here, not quite bulging posteriorly. If I switch over to this guy, I want you to look and see, boom, you see this bulging disc. It's pushing back on the spinal column, and this guy actually has got some issues, and almost every one there's a little bit of bulging. You can see how the disc is actually kind of pushed back. It's almost all of them are kind of narrowed and triangular and squeezing out posteriorly. So this guy's got multiple issues with the discs themselves. The posterior longitudinal ligament wasn't able to perform its job and prevent that protrusion of the disc back into the dura mater, the fecal space, the fecal sac rather, and then pushing on the area here, which it seems like it's okay here because this whitened area, that's the subarachnoid space, that's the cerebral spinal fluid that's in here, and then these are all the nerve roots. This is the cauda equina coming down here. So it's not quite pushing on the nerve roots yet, but down here, look at it's pinching. I'm surprised if this person is walking without pain or even sitting or lying or anything. We're pinching off that nerve root right there. This patient's gonna have a lot of pain. So kind of skip forward a little bit, but this is a really good study to show. And this also, you can see the anterior longitudinal ligament as well here. So you can see that, and you can't quite see, it's kind of mushy, the ligamentum flava on this guy. The flava flav is not very flavorful. You can kind of see a little bit of it there. So back to here. So we've gone over discs, we've gone over the anatomy. We didn't do sacrum and coccyx. I'm not going to go over that because that should be, I mean, legit, you should know sacrum and coccyx at this point. It's just not very common. I do want to show you, does this show? No. I want to show you a lumbar axial. I want you to see the bat wings when you get down into the sacrum. Let me see. Sorry, while I switch back and forth, I just want to show this to you if I can see it on any of these. There we go. All right, so it's an MRI, so it's not quite the same, but here's your lumbar spine, okay? We're traveling down the lumbar spine, and I want you to see, as we get down lower, see these wings, the ala or the lateral masses of the sacrum, sacral prominence, and then we're starting to get into our sacral foramen, okay, our first pair. It looks like a bat, okay? The sacral foramen look like the eyes, the canal, sacral canal kind of looks like the mouth, and then the sacral ala or lateral masses definitely look like wings. So when you're doing a lumbar spine CT, as you come inferiorly, if you see the bat wings, you're good to go. You know that you're definitely inferior to L5. You've included the joint space between L5 and S1, and you have successfully scanned the entire lumbar spine. So that is the spinal column, the spinal canal, which we looked at here, spinal canal, posterior to the vertebral body, transverse process, I'm sorry, spinous process, transverse process, here and here, intervertebral foramen. Now we'll talk about the meninges and the spinal cord itself, which is not quite as, the meninges themselves are not easy to see. We have 3 different layers that we know of. Let me go up here. It's down, up, 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 up. Let's see if it goes higher on the T1. There we go. Let's look at this one. So this one, I'll go all the way up, as high as it goes. Kind of, there's a lot of motions. Let me go to where it's the clearest. So right about here. Let's look here. All right, so we have the outermost layer. Okay, remember we have the outermost layer, and that is the dura mater. And it's a continuation of the dura mater from the brain. It travels all the way down into the spinal column, all the way down to about S2. So it forms the thecal sac, and then within that is the subarachnoid space. That's the space formed between the arachnoid mater and the pia mater. So the very innermost, here's your spinal cord here. The innermost layer on here is your pia mater. Okay, the next layer that sits right inside the dura mater is the arachnoid mater, which is in here. Thin space between arachnoid and dura out here. And then this space here, which is always going to show up as like a kind of like a fat sac, is your epidural space. Okay, it's very fatty. So on an MRI, especially on, this is T2, I believe. Yeah, on a T2, it's going to show up white, like fat is going to show up white. So there's your epidural space. You can kind of see, like this is ligamentum flava here. You can kind of see that. You can kind of see the posterior longitudinal ligament here, and then the space between there and there. This is your epidural. It's very thin anteriorly, it's very thick and fatty posteriorly. And inside that, you have the actual spinal cord itself, which is very small. I wish this were magged, and I wish I could find a better one for you, but I just can't. I want to go down, and I want to show you where, at the point where you can see it kind of right here. All right, so see how inside the spinal cord itself, you have cerebral spinal fluid is in there, but see the butterfly in there? Can you see this butterfly? I'll move the arrow. That's your butterfly. That's the gray matter that makes up the centermost portion of the spinal canal. So remember, you have your ventral and dorsal nerve roots that come out of here. So you have your sensory, which are your dorsal, your posterior, and your motor, which are your ventral or anterior roots. And then on each side, the ventral and dorsal come out, and they combine together and travel out as one nerve coming out the intervertebral foramen. So as I travel down, watch this kind of butterfly of the gray matter, and you know that this whitened area around the gray matter is your white matter. That's your myelinated axons, or the external portion of the spinal canal. So as I travel down, you can see how, I'm actually traveling up. Let me travel down. You're going to start to see, oh my gosh, this is opposite, I'm sorry. As I travel down, you're going to start to see the nerve roots as they come out. You're going to see your ventral and your dorsal roots coming out, okay? And then you can see how they combine, and then they travel out through the intervertebral discs, or the intervertebral foramen. So right here, this is a perfect slice where I'm seeing the ventral, dorsal coming in and combining, and you can see how that dura mater is extended out, and it is traveling out through the intervertebral foramen. And that's a nerve root. That's a nerve right there coming out with the sensory and motor combining together, traveling out. As I continue down, it's now going to separate out where I don't have a distinct gray matter anymore. So I have my nice thickened cord, and I'm now tapering down. That's your conus medullaris. So see how it tapers down? It's very thin. And I'm now switching over to these spindly fibers. That's your cauda equina, okay? So cauda equina right here, the horsetail within the cerebral spinal fluid, within the spinal canal. Okay, hold on. So that's the spinal canal, spinal cord, spinal meninges. Let's look at this from a sagittal. Let's go to the sagittal T2. So here, nice spinal canal here. It's going to taper down. There's your tapering, your conus medullaris. As we go down a little bit lower, you can see all the different spindly fibers. That's your cauda equina, okay? This space in here, subarachnoid space, okay? Subarachnoid space in here. The really fatty posterior is your epidural space. Subarachnoid space. We inject in this space when we do certain procedures, which you will learn in John's class. All right, so conus medullaris, tapering down to cauda equina. All right, let me see if I've forgotten anything. I think we should be good. I think that's it. All right, so for the test, the ones that I've shown here, the pretty obvious ones, should be pretty fair game. The mater, the pia mater, arachnoid mater, and dura mater, they're going to be a lot more difficult to see. But I'll do my best to really, really try to narrow it out so it's very easy to see. So here we have, this is obviously your pia mater. okay, because it's right on the spinal canal. So somewhere in here, the dura and the arachnoid are mashed together. You definitely should be able to tell that this is the epidural space, okay? It's the fatty space posterior to the spinal canal, and you have your ligamentum flava, or kind of like on either side of it, okay? That's pretty easy to see. It's very fatty. You should be able to see the butterfly of the gray matter in the spinal cord, and then as we get lower, I think this is lower, yep, you should be able to see the ventral and dorsal nerve roots, and then how they come out together and head out the intervertebral foramen. 31 of them. Okay, I hope that helps.